يلا بسم الله 3 2 1. Pan Friday is a habit that I developed when I was in residency with my co-residents and my professor, my attending, Dr. Brian Martin. Every Friday we used to bring our most interesting pans and we discuss our findings and potential treatment plan. Of course, radiographic readings or findings alone is not enough to diagnose and put a treatment plan together. It's just a fun way of learning and educating and throwing some ideas to look at, and also it's a way of training our eyes to look into those x-rays differently. Today's x-ray, it's a panoramic x-ray for a 9-year-old patient that came to our clinic, and we found out that he has a submerged primary teeth. So those primary teeth has permanent successors, as shown here on the pictures. So looking at these pictures, you can see that the upper E is submerged and the lower D's are submerged. However, further investigating those cases of ankylosis or submerged teeth, we don't have to intervene right away because those teeth have permanent successors, and according to the guidelines, those cases will actually exfoliate. So we have to put the patient on a close follow-up, and when the time is right, when they are close to exfoliation or a little bit delayed, then we can do extraction for these cases if needed. If this case need extraction, it can be done in clinic. You don't have to refer this case to a maxillofacial surgeon. You can actually do this case as a general practitioner or as a pediatric dentist. And good luck managing the behavior. Okay, mentioning the behavior, it's obviously the elephant in the room. So Sarah, what is the elephant in the room? شوفي لي شات جي بي تي. I'm sure chat GPT. What is the elephant in the room? Okay, so we cannot mention pediatric patients without mentioning behavior. It's very, very important to address the behavior. If the patient is comfortable and he is relaxed, he's a big boy, he can manage those extractions and he's done some sort of this complicated treatment on the chair, that's well and good. But if it was his first experience, you definitely don't want to lose the cooperation of this patient. So even if this patient was cooperative, okay, you want him to be very, very comfortable just in case this case was a little bit complex. So I would advise treatment plan this case, if he was with good cooperation, is to do this case with nitrous oxide plus local anesthesia on the dental chair, just in case this extraction went a little bit harder than expected. And I would refer to this treatment plan or behavioral treatment plan to the guidelines again. So if we have a cooperative patient with complex or complicated treatment, it is actually indicated to use nitrous oxide sedation for this case. Disclaimer, radiographic findings alone are not enough to diagnose cases. It has to be an adjunct with clinical examination, and you have to go through the whole process of investigating